Hello, everybody. Welcome back. Thank you for coming back. Remember, our title for this course was Thank you. Takes a long time to get across the country. Nice to be back. To remind you about the toolbox. Remember, we talked about the toolbox that was presented by some very important people in our community. They call it Toolbox Beyond Medications, Surgery, and Injections. And this course is about CBT, whatever that means. Cognitive Behavioral Therapy. If you change your way you think, your cognitions, you'll change the way you behave. If you change the way you behave, you'll change the way you think. But let's not sell the process of cognition, the brain, short. Let's take a look at knowledge about pain. What we focused on in this course is providing you with information. We've been providing you with knowledge. Knowledge is a cognitive process. You have to work, your brain has to take it all in. It's a cognitive process. Let's look at sleep. We've talked about sleep in this course. It takes a cognitive action on your part to change the processes of your sleep patterns that might improve your sleep. It takes cognition to change sleep. Changing lifestyle behaviors. Lifestyle are behaviors. We're talking about cognitive behavioral therapy. If you change your behaviors, you'll change the way you think. It takes active cognitive processes to change lifestyle. Gathering support. We are creatures of communities. From our tribal days to our clan days, we are community-based. It takes cognition. You have to actually think about why being in community is so important. It takes cognitive activity to gather support. We've talked about mindfulness, yoga, and breathing. Well, what's that all about? It's about cognitive changing the way you think. It's CBT. And then, of course, there's exercise. We all know the benefits of exercise and chronic pain. But did you know that exercise, only the benefit you get from exercise, only 10% comes from improvements in the musculoskeletal system. 90% of the benefit from exercise comes from changes within the neurological system, within the nervous system. Those endorphins that flow from multiple sources in your brain are central. The motor cortex that gets activated in exercise sends messages to other portions of the brain, including your emotional brain, your thinking brain. So it takes cognition, actually, for all these things. So this course is about changing the way you think, changes your behaviors. Changing your behaviors changes the way you think. But listen to this. All of these things outside the box are top-down mechanisms. So we prefer the title for the psychology of pain rather than CBT. CBT is that little box that nobody quite knows what sits in there. In fact, it's all got to do with your ability to change the way you think and the way you process. And that's what this course has all been about. This poor lonely guy sitting there with all these paths to go, you're not alone. This course is also to tell you, you are not alone. We're here with you. We are a community of people, and we're all here to help one another. It's part of that clan, being part of the social network. You're not alone like this poor man wondering which direction and which complicated road to go on. You are not alone. And that brings me back to breathing. You did this one. How many of you tried this one out? We got it on your stick. Perfect. And what you did by doing that breathing process is you learned how to slow your breathing and you learned how to slow your mind. Now you remember this, you saw it live. This was my friend Dr. Venant Francois Lowe. He stepped up here and we gave him a few mathematical sums. He's been teasing him ever since about having to go and take arithmetic classes. But he came up here, we gave him a few arithmetic classes, and what happened to him? Boom! He got a stress response. That's Dr. Francois Lowe. I'm teasing him a lot because not only does he need mathematical classes, but he's got to do some training around how to trigger the relaxation response. He said to me afterwards, "Oh, gee, I could have breathed slower." Oh, too late. Look at George's mother. George has been training her for a year now. George's mother, this is the same test done to Dr. Lowe. I gave her some mathematical sums, boom, she got a stress response. But what did she do? Within seconds, she brought herself down and she participated in the relaxation response. This is available to all of you who practice it repeatedly. It's not going to happen in a day. We've given you 5 weeks to integrate it since we saw you last. And this is what's possible. Now, George's mum can do this in the moment anywhere. If she's in the shopping mall and she's frustrated, she can do it in the moment. If she's in the doctor's office, she can do it in the moment. We all get activated. Let's join the club. There's nothing unusual about being activated. We all get activated many times a day. You can do this, but it takes practice every day for 6 months. You can do it. And Dr. Lowe has got some work to do. I'll be reminding him about the work he can do. We presented this information on the autonomic nervous system not as something that you can use. We presented it as information to offer you explanation as to why George's mother can trigger the relaxation response anywhere, anytime, any day, within 20 seconds. And it's got to do with balancing the parasympathetic with the sympathetic. This is an information piece, it's not a practice piece. Now, I didn't show you these slides before, but I'm going to try to summarize it in a different way. I tease my patients a little bit. I say to them, we've got two brains. We've got a thinking brain and we've got an emotional brain. They behave differently. And we've got hearts and lungs. And they're all tied together with the autonomic nervous system. Now, I can't say, Monique, slow your heart down. It won't respond. We can go through a thinking brain cognitive process where week by week we can train you to think differently, or we can go through an emotional training process. But the one thing we have control on is the lungs. That's your breathing. So we can say, slow your breathing. And you can do that. I can't say slow your heart, you can't do that. Ironically, you can slow your heart if you breathe slowly. Because breathing slowly means you have fewer sympathetic hits on your system. You get a hit with every breath. So the fewer breaths you take, the fewer hits you get. And it slows your heart rate. You've seen it on those people. And it increases what we call heart rate variability, which is a measure of health. So you can slow your heart, but you do it by slowing your breathing. And as you slow your heart, as you see those pictures of George's mother, her heart rate variability goes up, her heart rate goes down, her emotional brain stabilizes. Her emotional brain talks to her thinking brain and it stabilizes. So you can stabilize your two brains by slow breathing. That's the mechanism. It's all tied together by this autonomic nervous system. And that's why slow breathing works. It's connected through the autonomic nervous system. This is just an explanation piece. As Mary Ellen says, information is both information, it's data, but it's also an insight. If this gives you an insight as to why it works, then you know how to practice it and why, what the benefits are. And that leads to better health outcomes. This is where we started off on the first day, you may remember. We talked to you about a publication in the Canadian Literature 2010 that looked at a cross-section of patients who are on the wait list to be seen in pain treatment clinics across the country. So we said when we started off, we're trying to find out who you are and what can we do to provide information that might be helpful to you. 50% of patients on a wait list for a pain clinic have moderate to severe depression. 2/3 have moderate to severe anxiety. 1/2 have moderate to severe anger. So that's who I think we collectively are. So we've tried to deal with these issues in the course of this last 10 weeks. Anxiety and depression are part of the spectrum, but also we want to deal with the issue of anger. Why are we angry? You have the right to be angry for a lot of reasons. And Marianne's going to review what she talked to you about on anger.
Okay, so if you remember, one of the first things we talked about in the very first course was the idea that we're going to try to imagine a frame around this course. And the frame is needs, and when I say needs, I mean values, what's important to you. And as we went on, I tried to convey more clarity about what I mean about that, because this way of looking at anything actually can be really helpful in terms of getting clarity. And Bill talked about anxiety, depression, anger. Those are all feelings. And if you can imagine that feelings are like a signpost, if you think about it, why do you have a feeling? A feeling is information. It's telling you something. And if you start to recognize that your feelings point you in the direction of what's important to you, what your needs are, what your values are. And if you recognize that, you go in the direction of being in alignment with your values, of meeting your needs. We're not conditioned, we're not socialized to even think about what our needs are. In fact, we're often taught that, you think about what your obligations are. You think about what you're supposed to do, but you're never asked, what are your needs? And the real problem with that is if you don't think about what your needs are, pretty soon you don't even know what they are. And if you don't know what your needs are, it's pretty hard to meet them. So we're going to try to frame this course in a context of finding ways to meet the needs that you have, not only as a chronic pain patient, but as a person on this planet. And anger is one of those feelings which often, you've probably noticed, is not really encouraged. We had a specific question about anger and what do you do about anger? It's a really common feeling in response to chronic pain. But there's often sort of a negative kind of atmosphere around anger because we all have maybe negative memories around anger. Anger can be expressed in ways that seemed quite destructive. But actually, anger is probably one of the most valuable emotions that we have. But it's also one of the most misunderstood. And so it's really helpful, I find, to have a different understanding of all of your feelings, but specifically anger. And a book that I highly recommend is the book called The Surprising Purpose of Anger by Marshall Rosenberg. And it's a very thin little book, and he talks again about the whole concept of feelings in general and anger in particular, and finding the gift there. And what's interesting about anger is that it's very seldom that you have anger all by itself. Anger and guilt are almost always together, almost to the point of, you could call it a two-headed beast. Whenever you have one, you have the other. And often the analogy I'd like to use is a ping pong table, because in 30 seconds you can be back and forth between anger and guilt 60 times. And the operant word there is the word should. So we often should on ourselves and should on other people. Well, you should have, but you should have. And to recognize, we talk about cognitive behavior. This is cognition. So anger and guilt, they are feelings for sure, but they have a cognitive aspect to them. And that cognitive aspect, that thinking aspect, is blame. So with anger, blame is out towards other people, but with guilt, shame, and depression, blame is in towards yourself. If you can remember that blame is very toxic, It's a very toxic energy. And the irony is, it's like drinking poison and thinking someone else is going to die. You are drinking that poison. You are the one carrying around that toxic energy. It doesn't affect anyone else but you. Well, sometimes it does affect other people too, but it always affects you. And so to realize that these are actually secondary emotions. They're cover emotions. And if you go to the root of these emotions, they're always deeper, more vulnerable feelings. It can be feelings like disappointment or discouragement or despair sometimes, or grief, or fear. So if you can imagine instead that anger is like that warning light on the dashboard. It's a signal that we need to slow down the car, look under the hood, and realize we have a problem. We have something happening that's out of alignment with our values, that's not meeting our needs, that's challenging something that's very important to us, and we need to deal with that. And so anger is kind of like, it's a wake-up call. It wakes us up. And often you'll hear anger management courses, and often the anger management courses talk about venting, which is often, it just doesn't work. If you vent, it just makes the feelings of anger stronger. Or suppression, which is actually dangerous with anger. And both of them just simply don't work. But if you can imagine it's a warning light, you don't smash it, you don't cover it up, you recognize it has information. So anger is information. Anger is something to wake you up and recognize, I need to do something here. Because our needs are things that we have responsibility to find strategies to meet. And this is sort of a signal to let you know that you need to do that. It wakes you up to a problem. We talked about oftentimes anger is one of those feelings that happen when you flip your lid. And we talked about if this was the hand model of the brain. This is our reptilian primordial fight or flight brain. Your thumb is your emotional brain. And your fingers are your cerebral cortex or your thinking brain. And so often you can get triggered into many different feelings. Anger is very typical. And that triggering process is like flipping your lid. And the problem with that is then you don't have contact to your thinking brain. People will say things, oh, can't believe I said that, can't believe I did that. In a way, if you're only connected to your survival brain, you almost weren't there. So we talked about a process to help you to debrief it, to help you to have a step-by-step kind of straightforward method to connect to what's happening when you do flip your lid, when you do get triggered. And you'll notice the first thing there are cues that let you know that you are triggered. And although we all have all those cues, we have body sensations. And again, body sensations are only sort of the beginnings of feelings. Sometimes people will say, I'm not in touch with my feelings. I never know what I'm feeling. I don't know how to connect with how I feel. Sometimes people can only connect to a sensation. So, do you have any kind of sensation in your body? If you do, where is it? And you can start with a sensation, even if you can't connect to what your feelings are. But, tightness or tenseness or, your heart rate going up as we demonstrated. Breathing quickly. Sometimes there's like a sick feeling or a sinking feeling. All of these are really physical sensations. But then you have cognitive cues that let you know that you're triggered. Sometimes your thoughts race so quickly you could never speak that quickly. Or the opposite, your feelings, your thoughts shut down, you go blank. That can be a cue that you're triggered. Now the good news is the moment you say to yourself, I'm triggered, you've reconnected to your thinking brain again. That's why it's so important to start noticing the really subtle cues, because we all have almost a fingerprint of cues that let us know when we're triggered. We talked a lot about what I'm telling myself and realizing that we also have been conditioned to think that something outside of you makes you feel. Something outside of you can trigger a feeling, but how you feel is based on what's important to you, what your needs are. And so it's helpful to get clear on what am I telling myself when you look at something that's happened. when you look at what you're telling yourself, you can start to understand why you feel how you feel.
General figures in the general public about depression is about 3% are
Right.
depressed. Here you've got half in pain patients. And about 5% of the general public have degrees of anxiety. Here you've got 2/3 of the people with chronic pain are anxious. I don't know the numbers for anger in the general public, but you're watching an enormous, it's not just a minor increase, you're watching a massive increase in those symptoms in patients who have chronic pain. So it's the emotional brain. Remember, we've got two brains, we've got the thinking brain and the emotional brain. And so in chronic pain, we know that the emotional brain becomes highly activated. I showed you an image earlier on about a normal person. They were doing a functional MRI of the amygdala, which is the emotional center. It's this portion in the middle of the brain. And then they deprived that person of sleep for 24 hours, and you saw how the amygdala just lit right up. So if there's sleep deprivation, you get aggravation of the emotional centers. If you have frustration, if you have the things Mary Ellen is going to talk about further, losses and grief and pain and lack of sleep, that's what activates the emotional center of the brain. So this course is about how can we help ourselves with those things. There's two basic mechanisms to make it very simple about pain. One is what we call bottom-up sensations. Put your foot on a hot coal and you'll get a bottom-up message from the pain site to the brain. But the brain has top-down control mechanisms. And we're talking about how do you activate those top-down control mechanisms. And that's why it takes cognition and the thinking brain to help drive all these things down. You remember when I showed you the toolbox? There's thinking involved in all of them. There's cognition involved in all of them. So as we can help our cognitive processes, our thinking processes, help drive the thing back down, you can actually literally cool off that amygdala. You can sleep better. You can help deal. So we're trying to deal with the inevitable processes of depression, pain, and anger, which are universal virtually. And we're trying to help you see there are techniques you can use. Take George's mother. She can cool her emotional brain in 30 seconds, 20 seconds, just like that. So we're trying to help you to learn to see the tools that we can all use. In fact, they're helpful for people with high blood pressure, with diabetes, other heart disease, stroke, because there's common threads between all of our disease, chronic disease processes. So we don't really even know what turns acute pain into chronic pain. So why does somebody have a fractured ankle and it heals and no pain, and another person gets a fractured ankle and it goes on to chronic pain? We don't even know that, but that's a good question. Thank you.
It's a good question as well. And when I did my master's degree in my practicum, I looked at depression and chronic pain and which comes first.
Right.
The chicken or the egg.
Yeah, exactly.
Was there depression first and that predisposed the person to pain, or is it pain that really, and it really is not resolved at this point? It's, there's ways it can go either way.
There's a definite link between emotional pain and physical pain. And if you can help your emotional state, you will experience less physical pain. Mary Ellen will speak further about that in her next session, but there's a definite link. We have people who are fairly stable and a major emotional event happens in their life, the pain will flare. So that brings us back to trying to give you tools that you can use in those moments of emotional stress. We all have them. It's nothing unusually unique to the chronic pain patient. We all have emotionally upsetting moments. But remember George's mother, what she's able to do. They were trying to help you to see that and learn to model after her, because when you do have those emotional moments, we all do, and your pain appears to flare, it does flare. So just accept it. And then, as Mary Ellen says, what is it? If it's an emotional thing that's triggering you, so try to analyze that trigger. As Mary Ellen says, the minute you realize you've been triggered, that's the warning sign on the dashboard. That's a gift to you. Now I know what's triggering myself. I can take control on the moment. I can help do my slow breathing. I can do my meditation or my mindfulness. That's helpful. A comment about Leah's mother, talking about her, she's becoming mindful. You notice she's observing things. She's having naps and observing that she has more pain. So that's an exercise in mindfulness that she's exhibiting. So that's another moment for you to kind of put it into a mindful place, figure out what that emotional cue is, and try to help that cue, because as you do that, your perception of pain will come down.
But there's also the brain itself. We talked about when something happens, you prick your finger, there's a signal that goes to the brain. And I mean, pain is a survival mechanism. There are people who don't experience pain, and it's a big problem because you need pain in order to survive in this world. You need to know that that burner is hot, that you just put your hand down on. But the brain has signals it sends down that says, okay, you've taken your hand away and you're okay. And there's signals that come down to quiet that signal. What happens sometimes is because of what you tell yourself, that signal that comes down naturally, that all of us have, that loop from the brain coming down saying, okay, that stimulus is gone, there's no threat, you can let go of the pain signal. Some of us drown that out because emotionally and because of what we tell ourselves, we continue to think that there's a problem, there's a threat to us, and that's where we talk about anxiety and chronic stress, the idea that we're all constantly telling ourselves that we're under threat. And so that signal that's a natural signal from the brain coming down to quiet the pain is drowned out or doesn't happen. And you see, that's a message you tell yourself. And that message is sort of very catastrophic, thinking, oh my gosh, I've lost everything. Which, there's part of you that said, well, that might be true, but it might not be. And so recognizing you have choice about what you tell yourself. And you can choose to say, oh, well, this could be a bit of a setback, but probably not as bad as I think. Or that's where that sheet that I just showed you, taking a look at what you tell yourself when something, and that shows again that mindfulness awareness of what you're telling yourself. When you write that down, you get to see, okay, so maybe that's true, but maybe it isn't. Maybe it's an exaggeration, or maybe it's not true at all. But if you tell yourself that's true, you're going to have the emotional reaction that it's true. So sometimes it's that insight that you have more choice about what you tell yourself than you think. And you can choose not to tell yourself that. And my suggestion to you is that if you don't tell yourself that, you will have a better outcome than if you do tell yourself that. Do all those things because you want to make sure that you do everything that you can do to get the best possible outcome. You can still take those actions without telling yourself the absolute worst has happened. So all of us are aware that there's many, many losses related to chronic pain. Work and financial often is the first thing that comes to mind because, again, threatens our very survival sometimes. Primary relationships. We're wired for connection. We, as Bill talked about, we're tribal, we're clannish. We need support and connection. But sometimes it interferes with that. We don't have energy for that. We don't have patience for that sometimes. Mobility, energy for family. Exercise. Again, a lot of exercise maybe that we used to do, we're not able to do anymore. And even to be able to have the ease and to be able to have the presence of mind, to be able to meditate and have mindfulness. Sometimes it's difficult when we have chronic pain. So we talked about two of the major experts that talk about grief and mourning. And the idea that grief is basically, it's reconciling to change. And so it's interesting you were saying your husband's not here and you're doing more garden work. That's a change in your life. We often think that change has to be catastrophic in order to experience grief. But actually, grief is we have a response to change, whether it's positive or negative, and our response to it is grief. But grief isn't just one thing. It's a lot of feelings, a lot of thoughts. It's a whole kind of a cauldron. And even positive things, we think, well, they got married or they had a baby and isn't that wonderful? It is. But you would be surprised that there's also grief involved with those things as well. When you get married, it's wonderful, but there's a lot of challenge. It's a very different lifestyle, and there's things on the single life that you have to let go of. And there's loss around that. Having children, the same. It's a miracle, it's wonderful, but the first thing that goes often is sleep and a lot of other things that around choice and freedom. So recognizing that grief is just the organism's response to change and often loss. Mourning is the expression. And the problem is that expression not only is not encouraged, it's actively discouraged. And so basically we're left to grieve on our own. One of the things that's interesting about grief and to understand about grief is that it takes energy. And often if you have a major loss, it can take almost all of your energy. You have a little pie-shaped wedge of energy to survive. And often people will say, I can't understand, I can't remember anything, I can't concentrate, I can't find my keys. All those kinds of things, really, really common when you're grieving, because so much of your energy is taken up with grieving. And the reason it takes so much psychic energy and unconscious energy is because you're making decisions all the time. When you grieve, and when you have a major loss, there's basically a part of yourself that's lost. And so every time you come around a corner and you have an interaction with something, you have to decide, okay, how do I feel about this now? What do I think about this now? Who am I now in this situation? Because I'm not the same as I was before. And so it takes unbelievable energy to integrate a huge change and a loss, especially, into your life. And often with chronic pain, people don't understand that if you have a huge loss, maybe, and often there's more than one. You've lost your employment, you've lost a relationship, you've lost your ability to function in the way that you used to, a lot of losses, you're grieving. And that takes energy in and of itself. That's going to affect your memory. That's going to affect your concentration. That's going to affect how much of a fuse you have. So mourning, and again, the huge mixture of thoughts and feelings. I mean, you can feel lost, you can feel bewildered, disoriented, and the thoughts are often things like, well, what do I do now? When will this ever end? All those kinds of thoughts. Where will I go? Who am I now? Those are profound existential thoughts and feelings and questions that go on. And it's not surprising they take a lot of energy. If you can imagine your feelings are like steam. Steam will just dissipate. If you just let something boil, the steam just disappears. But we all know that if you suppress steam, you can run a locomotive, you can blow up an apartment building with steam. So basically, it's to understand that feelings are the same, that if you allow yourself to express your feelings, they'll just dissipate. Feelings last about 22 seconds. But if you suppress your feelings, what you resist persists. You suppress them, and sooner or later, they're going to blow. And they're going to blow often in unproductive ways. So the best way to deal with mourning a loss is something called the dual process. And again, if you have a big loss or a lot of losses, it can feel overwhelming just to think that you have to mourn that loss. And it's a lot. And so to recognize that even that, you can dose the pain. So it's that dynamic balance between giving yourself space and time to express and then taking a break from it, going and doing something where you totally let it go. When you take space and time, what you're doing when you're expressing is you're going towards it. And often we want to, again, to suppress it, to go away from it, to walk away from it. And it's almost counterintuitive often to say, okay, well, you need to go towards it. And basically express it and allow yourself to be aware of it. But not forever, not for a long, long time. You need to take a break from that as well. But society's message is not to express. Don't cry, don't complain, stiff upper lip, just grin and bear it. And if you want to celebrate, bring it on. Everybody wants to celebrate. But if you need to mourn, you go do that. Come back when you're done. So we're encouraged to mourn in isolation, which is not a good place to mourn. Anybody heard any of these messages? Yeah. Very unfortunate. Really unfortunate. And that's why these kind of groups are really helpful, because people that understand chronic pain, when they talk to each other, can support each other. They can understand how important it is to express. And it's not that you're just whining or complaining. You need to talk about, you need to tell your story. You need to integrate your story into the rest of your life and have it make sense. And it's important. It takes a long time sometimes.
Mary Ellen asked if any of us would like to make a comment about grief, loss, and mourning. I would. When we prepared this course, try it yourself. Google psychology of pain or CBT and then match it with grief, loss, and mourning. What will you get? 0. There's virtually nothing out there that talks about grief and loss and mourning. And quite frankly, I'm overwhelmed by that, because when I listen to my patients, I hear the stories over and over again, and I want to reach out to all of you when I say this. I used to go kayaking, I can't anymore. I used to do gardening, I can't anymore. I used to work, I can't anymore. I used to have a good relationship at home, I don't anymore. I used to be able to go and play with my children in the snow, I don't anymore. I hear it all the time. That's grieving for the things you used to have that you no longer have because of pain. So I'm very pleased we brought up the whole topic of grieving and mourning and loss in the context of this talk. Mary Ellen is a grief counselor at hospice. So she's dealing with grief and mourning by the survivors of those who lose loved ones. And so it's a very important part of this course, we think. And it's completely overlooked if you go looking for it in the literature. They don't talk about loss. But I don't have to talk to you. You know what I'm talking about, because you all have experienced it. So I'm hopeful that Mary Ellen's insights will be helpful for you. Ah, yes. Those trains that go through in the night. I really enjoy this talk on sleep because it helps me to sleep better. But I hope it's been helpful for you to understand that there are cycles. We have sleep cycles. I hope you to realize that the architecture of the train is intact even if you have chronic pain. It's normal to wake. One of my patients in Revelstoke, she's sitting over there, told me how helpful it was to realize that waking at night wasn't bad. It's good, it's normal. And if you dream just before you wake up, it's because you've come back into a light cycle. It's a good thing. Breathe slowly, you'll be off to sleep on the next train. I hope you found this interesting. Remember the cyclical pattern that happens every day. We have variability in our cortisol levels, and we have variability in our melatonin levels. But, being a modern society, we extend the light into the night, don't we? And we waken at 3 a.m, we put the lights on, and then we wonder why we can't sleep. So the tricks that we've taught you and given to you, these sleep strategies, are intended to help those of you who have difficulty sleeping and see if you can make some behavioral changes that will make you change the way you think about sleep. Or think about what you can do behaviorally that'll make you sleep better. And if you can sleep better, that emotional component of your brain will calm down. You sleep better, you function better. This is to remind you about the man who really modernized the whole concept of mindfulness and meditation, Jon Kabat-Zinn. He's the founder of mind-body medicine in Harvard. He's still alive and very well and fit, as you can see in this picture. He's the one who's driven most of the research in this field. And he's published endlessly, and we want to give credit for where credit's due. He says in publications that alterations in brain and immune function are produced by mindfulness and meditation. And he says that changes will take place as quickly as 8 weeks. In fact, George's mother can make it happen in 20 seconds. But she didn't make it happen out of the blue because Dr. Lowe couldn't make it happen out of the blue. George's mother did it because she repeated and trained herself to do it. So it's got to do with repetition, 1 degree course correction. Do it every day. You've got to commit yourself to do it. If you don't believe it, it won't happen. If you don't do it, it won't happen. It requires daily, patient participation. And those daily activities can become a lifelong habit. You can't stop George's mother now from doing it. She's discovered the trick. She's discovered the trick. When she gets aggravated, when she flips her lid, when she has an emotional moment, when her pain flares, she moves into action. So it's a question of encouraging you to recognize that it happens. There's scientific proof that it happens. It takes a daily change and it takes a commitment. And you cannot take George's mother and reverse her experience. It's now hers forever. It can be yours. Meditation, yoga, mindfulness-based cognitive therapy, relaxation, imagery, it doesn't matter what you do. Do what you like. Find something and commit yourself to it. And all of these things have one thing in common: deep, slow breathing. So you can forget all those other things and just go straight to the breathing. It doesn't matter what you do, because if you do those other activities, you will invariably slow your breathing. You'll slow the message to your heart rate will slow down, your heart rate variability will be going up, your emotional brain will calm, your thinking brain will come down. And they've been telling us that for 2,500 years, those Buddhist monks. And this is, I showed you this before. As recently as March 2014, they showed that if you can breathe at a rate of 5.5 breaths a minute, you will increase your heart rate variability. That's got to do with that little breathing thing. Forget the science, just practice the breathing.
We also talked about the wheel of awareness, again, another mindfulness practice that, brings insight into the idea of mindfulness. But the main thing I think that we wanted to stress with this course is that all of these, something will work for somebody and it won't work for someone else. And so I think the real quest here is to discover what fits for you. Try something and give it long enough to really have a sense of being able to connect with it, and then decide, is this for me? It might be a while before you find exactly the thing that works for you. This is the one where you start looking at your 5 senses, go into your body, go into your thoughts, your feelings, hopes, and basically, again, look at even just looking at your relationships and having insight in that, giving yourself time to just be with that, be mindful, breathe into it. It's amazing the kind of insights that will come out of the wheel of awareness, and it also gives you perspective and brings you back down. But the idea that if you think about the essence of what we're trying to present here are strategies to enhance your well-being. We're presenting not only strategies, actually, we're presenting strategies and insights. Sometimes insights are even more powerful, because when you get an insight, you might come up with your own strategy. And what I found with counseling in general is that generally, when people come up with a strategy themselves, it's much more likely to be effective than anything that I can come up with. Because when I think of something, I'm looking at you and I have a very limited picture of what's going on with you. When a strategy emerges from you, it emerges from your whole context. And it's taken a lot of things into consideration that you couldn't possibly communicate in the length of time that you would be working with someone. So it's to look at these strategies as suggestions and realize that one of them might be perfect, but it might not, any of these might not really work, but they might allow you the place of mind to be able to have strategies emerge from your own experience that will work even better. But remembering that the strategies are just the form, and what you're looking for is enhanced well-being. So the form can be so many different things. We talked about slow breathing, mindfulness, meditation, exercise, sleep. Don't give up. Don't give up. Whatever you decide, whatever you try, give it long enough to give it a real chance. And if it doesn't work, there's so many others. There's millions of different ways, and there's different combinations of things that could be helpful. So I think one of our sort of take-homes that we want to present from this course is the essence is you want to find a way to enhance your well-being. You want to find a way to live better with pain, to have a better experience in your life. There's a lot of different ways, and there's a lot of support around finding that, that slide with all the different roadways. The reason that these strategies work is because of something called neuroplasticity. And what that means is that the things that you do, and even that the way that you think, actually changes physically the structure of your brain. So thinking, and again, recognizing that thinking affects behavior, and then behavior affects thinking, so it's a loop that goes both ways. Your circumstances, your environment, your emotions, as well as, I mean, we all know that bodily injury, if you have a head injury, it affects your brain chemistry, but also your brain physiology and structure. But to realize that besides actual physical things that can happen, thinking, behavior, and emotion actually change the brain. So it's the key to understanding why changes can take place over time and why it takes 8 weeks for that to happen. It's like the brain actually grows new brain cells. It's like water going down a certain pathway and you start directing it down a different pathway. It takes a while for the groove, for the water to carve out a new pathway. That other pathway is always going to be there, but it's going to be kind of shallower and shallower as you always go to the new pathway that's more effective. Again, that's why practice is so important. Practice is, again, 1 degree course correction. It doesn't happen overnight. It happens gradually and slowly over time, because gradually and slowly over time, your brain changes its actual structure, which is pretty amazing.
Okay. I'm going to introduce you to a challenge here. So I'm going to challenge you. For those of you who listen to these tapes, you may have heard a statement that I made that said, a certain amount of stress is helpful for that natural flow of life. But when stress becomes chronic, it can become disabling. Do you remember that? Is that some of you? So here's a question for you. As a question, don't answer yet, I'm going to ask you in a few minutes. Part A. Stress is harmful and should be avoided, reduced, and managed. That's one of your choices. Your second choice is stress is helpful and should be accepted, utilized, and embraced. Think about it for a minute. Stress is harmful and should be avoided, reduced, and managed. That's a belief system. Or, stress is helpful and should be accepted, utilized, and embraced. So here's the question. I'm going to ask you to put your hands up. You can either pick A, you can pick B, or you can pick both A and B. So here's the question. Are you ready for it? Who thinks A is the dominant belief system? How many of you think B is a dominant belief system? How many of you know that it's A and B both together? Great. So now, that's a really great insight for all of you to have. I've just come back from Africa. For a baby to be orphaned at age 1 in the middle of a third world country is overwhelming. That child is overwhelmed. That's not a good option. For that child at age 1 to be orphaned because both parents died in a third world country, stress is harmful, should be avoided, reduced, and managed. That child is definitely stressed too much. Now, stress is helpful, should be accepted, utilized, and embraced. That's the inherent belief in my own life. I wouldn't be here standing my age in front of you if I didn't believe that stress was helpful. I try to find value in it. So you see, both are correct. I've been able to get here because I've been a bit lucky, and that little infant I saw a month ago in Africa was orphaned. It's not helpful for that child. But if you try to find where both can be helpful, you can use both. Now, to be honest, chronic pain is overwhelming for many people, and I want to accept and respect that. But we also want to open that little window in your mind where you can actually use certain things creatively. You can actually find stress that's not as big that can be helpful. There's a guy called Martin Seligman. He's a professor of psychology at Philadelphia University. He writes a book called Flourish, and he's the author of the whole movement around positive psychology. He was summoned to the Pentagon. He was called by the Joint Chief of Staffs at the Pentagon. And the guy said, "We want to hire you to find a strategy for the U.S. military to deal with post-traumatic stress disorder in all our soldiers coming back from the war." And he said, "Yes, I can help you with that. We're experts on that. I can help you with that." Then he paused for a while, and he said, "How many come back stressed?" They said, 20%. Yes, they need help. They were ones who were stressed to the point of pizza. But he said, "I'm interested in another question," he said to the Joint Chief of Staff. He said, "I'm interested in those 80% that come back having had the same stressful experiences, and they don't have post-traumatic stress disorder." He said, "I'm interested in knowing why they come back and they're in better shape than they were when they weren't." And that brings you to the topic of resilience. So some of the soldiers come back stressed, they were overwhelmed, and they're stressed. Some of the soldiers come back and they're resilient. What is it that creates resilience? So you see, in supporting you, a population of my friends and patients, into the process of chronic pain, we want to both be respectful and support the journey that's tough, but we also want to look for and tweak that moment of resilience that's in each one of us.
So I'd like to talk to you about a lady named Kelly McGonigal, and she has some great TED Talks that you can look up online as well. And she, for almost a decade, talked about stress as very toxic. Stress is something that has to be managed, that stress is the A part of it. Stress will kill you. Stress is bad. Stress has to be dealt with. And then she came across some research, shocking scientific findings. And they were that high levels of stress increased the risk of dying by 43%, but it only applied to people who believed that stress was harmful. So that is really interesting. And again, it comes back to cognitive. What you think matters. What you think makes a difference. What you think about stress mediates what kind of effect it has on you. In fact, the high levels of stress resulted in the lowest risk of death when people did not believe that stress was harmful, even lower than people who had low stress in their lives. So that's interesting. And she writes a book called The Upside of Stress, which I also would highly recommend. She talks about that there's two responses to stress. We have the fight, flight, freeze response, but we also have the challenge response. They're similar, but they're different. And it really makes a difference which way you go with this. Fight, flight, or freeze. This is when it's high stress, usually, although sometimes this can be activated by things that are not really high stress, but there's a sense that your survival is on the line. And you have adrenaline and cortisone secreted in whatever ratio they are in fight, flight, or freeze, usually resulting in fear. It mobilizes energy so that you're alert, you're ready to act, your sympathetic nervous system is on fire, your heart rate speeds up, your muscles have more blood so that you have high physical capabilities because it's fight, flight, or freeze. You're either going to fight that saber-toothed tiger or you're going to run away, or sometimes you just freeze. The challenge response is usually when you perceive cognitively that the stress is there, but it's less threatening. You still have adrenaline and cortisol, but they're in a slightly different ratio. You're focused, but you're not fearful. There's increased energy to perform under pressure. It's a stressful experience that's beneficial. It's not harmful. And you have increased confidence, enhanced concentration. They talk about peak performance. Talk about people who have stress in their life on an ongoing basis, but it's stress by choice. One of the demographics they looked at were surgeons. Surgeons deal with crisis in the moment, have to think fast, but the challenge response is what's triggered. All of a sudden they know they have to perform, and they're on. Everything's on. It's not running away. It's running towards. But the cognition is that it's not threatening, that it's not something that's going to threaten survival. What I'd like to again, focus on is that it's never either or. I think it's both. And stress can be toxic and beneficial at the same time, which seems weird, but I think it's possible. And again, it's not about trying to completely change how we feel about stress. It's getting back to the 1 degree course correction. Can you have sort of a subtle shift? Can you start to just even begin to entertain the idea that sometimes stress can have a positive effect and start to look for that? It's like looking for the gift. So to rethink stress. And one of the ways to do that is basically if you want to have this sense that stress could be beneficial, and when is it beneficial, one of the ways to start is to look at meaning. And that brings us back to needs. Remember we talked about our frame around needs, values, what's important to you. A meaningful life is a stressful life. If there's something that's meaningful to you, it will probably result in stress at some point. You know, I mean, parents are a perfect example. Your children are totally the most meaningful thing in your life, and they're the most stressful as well, because if their life is threatened in any way, shape, or form, it's huge stress. So what brings meaning to your life often brings stress, but it doesn't have to be debilitating stress. And one of the things that she talks about is as you get clear about what is meaningful in that situation, when you focus on the meaning, it can be helpful. So focus on the values, the needs, what's meaningful. It can shift the story that you tell yourself about stress. You're more likely to approach and have the challenge reaction instead of the fight or flight. And you're more able to see meaning in adversity. So again, as Bill was talking about, it's the concept of resilience. So I just looked up resilience. The Oxford Dictionary definition of resilience is the capacity to recover quickly from difficulties. They call it toughness. And Wikipedia is defined as an individual's ability to properly adapt to stress and adversity. It should be considered a process, not a trait, which can be learned and developed by virtually anyone. So again, it's this idea that with the 1 degree course correction, you can start going in the direction of resilience, of recognizing a stress as something not necessarily all negative. Viktor Frankl he was a psychiatrist during the war in Germany. He was a Jewish Holocaust survivor. And basically that's his main tenet, that everything can be taken away but one thing, and that's the last of the human freedoms, and that's to choose one's attitude in any given circumstances, to choose one's own way, and basically to choose what you think, how you choose to see things.
I was very pleased to see that almost every hand went up when we said it's both A and B. So in closing, I want to say this to you. You're not alone. We know that stress and chronic pain can be overwhelming. But we have to be there with that little baby now in Africa who's lost both of his parents. He needs help. He needs big help. And, you know, when you need help, we're here for you. But it can also be helpful if you can look for where it's not overwhelming, but you can see it as an opportunity to grow your resilience. And we all are here because we all have a degree of resilience. You wouldn't be sitting in this room if you didn't. So tap into what you already have. Grow it. Grow it 1 degree at a time. I want to thank Linda and Danny for supporting the course here. I want to thank Coralie in Enderby and Curry in Revelstoke. Thank you, Curry. Thank you, Coralie. And thanks to all of you for coming.
Thank you.